when you hear somebody, when you hear their story, and then you help explain to them and educate them that this is why movement's important, so we can get back to those things. It helps return people to their why and really start to address some of the root cause factors that might be causing their pain to progress. Welcome back, everyone, to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to be talking ankylosing spondylitis. Sounds confusing, but it's a disorder of the back and has to deal with back pain. So if you're somebody that deals with a lot of back pain, stick around. So back pain is one of the most common things that people complain about throughout life. 85 to 90% of people are going to deal with debilitating back pain at some point in their life. Mm-hmm. So I'm excited to kind of cut through a little bit more of what ankylosing spondylitis is. But before we do that, if you've been enjoying these videos, please consider clicking subscribe, hitting that notification bell so you can always stay in tune on what we're putting out on this YouTube channel. I mean, essentially, we hear itis in that title, so inflammation is what we start thinking, so inflammatory disorder, but essentially what it means is our back is starting to grow a lot more osteophytes or bony growths, and it kind of presents early on like an arthritis. Symptoms can be similar to what arthritis might be, but in severe cases, those bony growths can start to fuse together, so this is kind of known as like the fusing back disorder, where people get really stiff spines.
Yeah, and it kind of progresses into that because it's a chronic inflammatory autoimmune disease. So think of any other kind of autoimmune disease. They usually have some sort of progression to them, and your body is almost attacking itself, right? And so we have to get back into the root causes of those autoimmune diseases. And I think it's easy to look at the spine and say, oh, well, I'm stiffening, I'm getting more pain, I'm losing range of motion, so I need to only do things that affect me physically. But we're going to actually talk about how what we see, especially between a lot of patients with ankylosing spondylitis, that it's not just physical movement that can really help and causes this impairment.
Well, and anytime we talk inflammatory disorders or back pain, our mindset, our psychology, and our emotional health is very important to how that back pain presents and ultimately how it affects our life.
But what they do see is a pretty strong connection to an allele, a gene, a genetic component known as your HLA-B27. So they see this allele particularly in 90 to 95% of patients who do form ankylosing spondylitis. However, the good thing that we want to point out here is that still 1.5 to 10% of patients that have this specific allele are completely asymptomatic.
Asymptomatic and are seeing a lot lower progression of that disease in the spine itself. So that's where I always start asking, okay, what are those people doing? What are those up to 10% of people doing differently? Because they also have the gene. So there's got to be other contributing factors as to how fast this might progress. And the research is up to 70% of people that were presenting with ankylosing spondylitis had inflammation in their gut.
That's where you want to say, okay, am I working with a registered dietitian, someone who I really trust in terms of how do I understand my gut microbiome and what am I doing? What am I putting in my body that really kind of can cause some effect and possibly make some changes there, right? And especially someone who's going to look at your hormones and do some testing and kind of figure out what supplements or food might be best for your individual body. Again, outside of our scope of practice, but I think that just shows so importantly what the whole picture starts to look like. And now we go into a little bit more of our realm of things, which is movement. And actually, still talking about like kind of your gut inflammation, exercise was seen to lower what's called calprotectin, which is kind of like your protein blockers that they find in feces that kind of causes that intestinal inflammation. And so this is associated with a reduction in the disease activity. So exercise alone can help your gut permeability.
Yeah, and there was a lot that talked about respiratory activities or making sure that we keep mobility from our pelvis to our rib cage, keep those ribs expanding, because anytime we get degeneration of the spine, all of our ribs attach back into our spine. So we want to make sure that those ribs are continuing to move really well so that we keep good breath support and keep that active core canister that's going to help support the back in general.
Yeah, and when we're looking at physical therapy, of course we want to maintain as much spinal mobility as you have. So this is where it becomes a super personal plan. And this is where we're not going to talk about specific exercises that are needed for ankylosing spondylitis, because what the research continues to point out is that a supervised physical therapy individualized plan is way more beneficial than just having a generalized movement plan for yourself and trying to do it on your own, because everyone's disease progression is going to look a little different. Where you are within the disease is going to look a little bit different. So we want to know, how much mobility do you have of your spine currently, and what is safe for you to continue to move into. We want to know what your current function is within your body so that we can progress you accordingly. And we're really trying to, along that journey, control your own pain and inflammation. That's why just going to scroll Google or trying to listen to this podcast for a specific exercise, we're not going to give it, because the research is super clear that an individualized program is going to be best.
If you're trying to keep yourself physically active, there are so many positive benefits that come from physical activity. So between 2 and 4 hours of physical activity per week can really help mitigate levels of pain, but also, like we talked about earlier, that mental emotional battle that we tend to play when it comes to pains in our body and how they impact our ability to stay active and stay engaged in our environment.
Yeah. And then another study even went further in saying that back exercises, again, specific to what you need, 5 days a week plus recreational exercise, 200 minutes per week, was seen to really reduce pain and stiffness, increase function, and slow the progression of this disability over 5 years. So they're continuing to say a sedentary lifestyle is one of the worst things you can do for ankylosing spondylitis. And there was even studies that showed that 20 to 40% of patients didn't really respond too well to pharmacological treatments. They responded much better when it's in conjunction with either physical therapy and cognitive therapy, actually.
Yeah, and that's, again, where it's coming back around to this whole thing that we have to address when we talk back pain. It's not just a physical thing. You know, it's physical, emotional, mental, social. How do we feel we're connecting with the people around us, with our family? Do we feel like our back pain is starting to prevent us from being able to go to family activities? And that's when we really start to spiral down into this almost helplessness, like, oh, my back hurts, so therefore I can't move, so therefore I can't participate in the things that I love in life.
Right.
And what the research is showing is that, okay, even when we have a degree of pain, you need to be able to stay active, because when we have pain, the first thing that we want to do is stop.
Yeah.
I need to stop moving so I don't feel that pain.
Yeah.
And that's kind of a negative feedback, where the less we move, the more pain we might feel, but then also the more it affects us emotionally, mentally, and socially to be able to meaningfully participate in life.
This idea of like, okay, it is safe to move, and that's okay, even though I might feel a little pain and
you're not going to do more damage.
Yeah, you're actually going to help more than you would. I think that's super empowering, and hopefully you can find a great therapist near you. Don't feel bad if you need to try out a few therapists, you know?
Yeah.
You don't always jive with everyone, and that's okay. And someone might be a little bit more personalized or hear your journey a little bit more than another, and that's totally fine. So finding a therapist that really feels like they're working with you and they're guiding you through a really solid plan so that you feel supported is so important.
That can be one of the toughest things. Like, all right, I'm going to go to somebody. I'm going to finally go to somebody, and it just isn't a good fit.
Yeah.
Or in those first few visits, you just don't feel like they're seeing you. They're actually hearing your story. The people that Jen and I work with, back when we worked with clients a little more intimately one-on-one, they would just say like, oh my gosh, you're like the 20th person that I'm seeing, but it feels different. I finally feel like you're listening to me. And that's where Jen and I always understood that it's very important to be there for the person and hear their emotional story, hear how it's impacted their life socially, so we can start hitting on some of those cognitive bits, even though that's not directly what we're treating.
Yeah.
When you hear somebody, when you hear their story, and then you help it, explain to them and educate them that this is why movement's important, so we can get back to those things. It helps return people to their why and really start to address some of the root cause factors that might be causing their pain to progress.
Thanks so much for sticking around for another podcast with us. I hope you learned a little bit. What surprised you? What are you going to share with other people who might have this disease? Please pass these episodes along to other people. Share the links out. Get people subscribed so that they can continue to learn about their body as well.